Hi, I'm Dr. Erin Hunt Carter, and I'm a clinical psychologist at Great Lakes Mental Health. Today, I'm going to talk about sleep hygiene and the basics of cognitive behavioral therapy for insomnia, or CBT-I. This video is for general education. It does not constitute therapy, but if you are my client, hello! And also, please bring this video up next time we meet so that we can tailor strategies to your specific situation. Okay. So, broadly speaking, there are two systems that control sleep: your circadian rhythm, the internal clock that regulates sleep wake cycles, and your sleep drive, which is the pressure to sleep that builds the longer you're awake. CBTI works by helping these two systems realign. Exposure to natural light in the morning is the most powerful regulator of your circadian rhythm. This regulates serotonin, which is a neurotransmitter that supports alertness, mood, and focus. On the other hand, melatonin is a hormone that helps initiate sleep at night. Being exposed to darkness allows our melatonin levels to rise. So try to go outside or near a window within the first hour of waking. If these aren't options, you might want to consider buying a light therapy box. Even 10 or 20 minutes of morning daylight or light therapy can make a meaningful difference in your sleep. We also recommend turning the lights lower in the hours leading up to sleep. I tend to start shutting off some lights about an hour or so before bed, kind of like simulating sunset. Also, consider putting your phone away an hour before bed, or at a minimum, using a blue light blocker, because blue light can trick the brain into thinking it's still daytime. Another powerful CBTI strategy is to set a consistent wake up time, even on weekends. This strengthens circadian rhythms and supports melatonin release at night. People often worry that one night with little sleep will lead to ongoing insomnia. However, as long as you get up at your regular wake time and refrain from napping, a poor night of sleep should actually increase your sleep drive and improve the odds that you'll sleep well the next night. Next, we want to retrain your brain to associate being in bed with sleep. To do that, you should use your bed for sleep and sex and not much else. You may have heard people say, if it fires together, it wires together. When two things are consistently paired, the brain links them up, and one starts to trigger the other. If you spend long periods awake in bed, worrying or watching the clock, the brain begins to associate being in bed with alertness, anxiety, and frustration instead of sleep. So go to bed when you feel moderately sleepy. If you're awake for more than about 30 minutes, get out of bed and do something calm and boring in low light until sleepiness returns, and then try again. Keep your set wake up time, even if you don't get much sleep, and don't nap the next day. This is going to increase sleep drive and help your body get back to regulated sleep. The last thing that I want to talk about is trying to fall asleep. People often put a lot of effort into sleeping better. Unfortunately, trying to sleep tends to wake us up. This makes sense because when we worry about sleep, it activates the brain's threat system, the sympathetic nervous system. Our brains can't tell the difference between an angry bear and anxiety that sleep deprivation is going to ruin the next day. Both things kick off biological systems that tell us to be awake and alert for danger. So if you notice negative thoughts as you're trying to sleep, I want you to try talking back to them. For instance, if your brain says, I have to sleep, or tomorrow will be a disaster, try reframing that thought to say something like, tomorrow might be harder with less sleep, but I will be fine. Just resting my body will help, even if I don't sleep. Also, please remember it is completely normal to wake up 3 or more times per night. We just don't usually notice or remember it. When you're anxious about sleep, you tend to notice those nighttime wakenings, and this can trigger a spiral of anxiety. Practice telling yourself waking up a few times at night is actually a sign of healthy sleep. I want to close by encouraging you to aim for progress over perfection. Make small, consistent changes and observe what helps. If sleep continues to be a struggle, consider talking with a licensed therapist or a physician. Thanks for being here.